To begin with, the discussion draft of the Senate health care bill makes no change in the law protecting pre-existing conditions, no change in Medicare benefits, and it increases Medicaid funding, that's TennCare, at the rate of inflation. Now let me repeat, it makes no change in the law protecting pre-existing conditions, no change in Medicare benefits, and it increases Medicaid funding, that's TennCare, at the rate of inflation. Here's some other clear benefits for Tennesseans. It offers health care coverage to 162,000 Tennesseans who make less than $12,000 a year and under the current law receive zero help buying insurance. For the 350,000 Tennesseans who buy their insurance in the individual market, these are Tennesseans who don't get their insurance on the job or who don't get it from the government. It means they're more likely to be able to buy insurance next year instead of being in the collapsing Obamacare exchanges where there may be only one option or even zero options to buy insurance. It repeals the health insurance tax, which drives up the cost of premiums. It gives the state more flexibility, and it continues federal cost sharing, which our state insurance commissioner said will help bring down the cost of premiums. Overall, it slows down skyrocketing premiums, which in Tennessee have gone up 176% over 4 years. It repeals the medical device tax on one of our state's largest exports. It repeals the employer mandate penalty, which should mean that employers should be able to offer employees more choices of insurance at a lower cost. And about 60% of us get our insurance on the job. It ends the tax on individuals who choose not to buy insurance. It provides more money for hospitals who serve low-income Tennesseans who don't have insurance. There's new funding for opioid abuse, and opioid abuse is a rampant epidemic in our state. And there's new Medicaid funding for mental health to double the number of days of inpatient treatment. So I'm going to review this draft. I'm going to see what it costs when the Congressional Budget Office gives its report, either over the weekend or on Monday. Then I'm going to stay focused next week as the bill goes to the Senate floor, where it'll be subject to virtually unlimited amendments. And my focus will be on how does it affect Tennesseans.